Hello there, welcome to the emergency clinic appointment. So I think we're dealing with a foreign body in your right eye. I understand it's painful and uncomfortable. But the first thing I have to do is check your vision. So cover your left eye. Have a look at the tumbling E chart there. Now I want you to try the bottom row. Tell me, moving along, whether the E is pointing up, down, left or right. Okay, and as you can hear, we have some rain sounds today. Cover the other eye. Try the bottom row again. Up, down, left or right. Thank you. Now I am going to try and take away some of the discomfort. Put some anaesthetic into your eyes, some lidocaine fluorescein. It is important that when this goes in that you do not rub your eye, please. Look up to the ceiling. Okay, now that's gone in, you should get some immediate relief. Before checking if there's a foreign body in your eye, I'm just going to take some questions. So, right eye only. When did the feeling of discomfort start? 9 AM. And what were you doing at the time? Left eye is completely fine. So no idea what the foreign body is. What's the pain level out of 10? Or what was it? Okay, and you don't feel there's been any loss of vision. Has anything like this ever happened before? Any discharge? I mean, we will check for these things anyway. Redness? So more uncomfortable than painful. Any floaters in the vision? Any flashing lights? No shadows or curtains in the vision? Any double vision? So we're just dealing with the right eye. I am going to have a look with a special device. We need some extra light on the area in question. Relax, look straight ahead at me. Do not attempt to rub the eye. And let me have a look. This is going to allow high magnification. Okay, now the cornea looks clear thus far. Now I'd like you to look up to the ceiling. Okay, look to your right hand side, please. And to your left. Now look down to the floor with a wide open eye. Okay, close the eye now. Thank you. Now, I can't see any static foreign bodies on the cornea or conjunctiva, but what I can see is a loose eyelash lurking in the lower fornix. So look up to the ceiling for me. I'm going to fish it out for you. Look up again, please. You're looking up. Excellent. Looks as though we've got the foreign body there. Now, it's not as simple as just removing it and sending you on your way. I'm going to perform a more extensive and detailed examination. So let's just make a note of that foreign body removal. Loose eyelash, lower fornix. Even though there was nothing on the cornea, we still have to do some staining. Vision. Using the 40 centimetre tumbling E. 6, right and left. Right, I'm looking for some ocular lubricants. I'm going to pop a drop in now and a drop in after. I'm going to use the Hycosan extra, so look up for me please. And the left as well. That should provide comfort and a nice little barrier. Okay. Let's pop a bit more dye into the eyes. Look up for me. Right and left. Right, let me set up the cobalt blue filter. Okay, look straight ahead for me please. Blink. Checking all 5 sounds of the cornea just to be safe. Okay, look up. Look down with a wide eye. To the right and left. Okay, now indentations from the lash and now further ocular staining. Check the left as well while you're here. Look straight. Blink. Look up. Look right. Look left. Down with a wide eye. Okay, now apparent staining on the left. Okay, let's jot that down. So corneal staining. Split the cornea up into 5 zones there. Clear, clear. So that's good news. So it seems you would have just been feeling that loose lash. It may have brushed against the cornea at some point and made contact, but there is no residual damage there. Okay, I just want to grade the cornea and limbal area. So look straight. I'm doing the right eye first. Look left. Look to the right. Up. And down. Maybe a little bit of conjunctival redness there. Let's compare that to the left. Look straight. Up again. Down to your right. Left. And up. Once more. And down. Say the conjunctival redness in the left, 0.5, limbal 1. For the right, conjunctival redness, grade 1.5 in the inferior zone, 1 in the other zones. Limbal redness, 1.5, specifically the 4 to 7 o'clock region. Possibly a little bit of extra redness on the right. Okay, it is important to check your intraocular pressures. I don't want to let you go and there to be an issue. I've got to cover all bases, so look up for me please. And we always do the left as well. So that is always a useful tool to check against the right eye. Okay, any history of your previous IRPs being mentioned? Not to worry, this is the Perkins model. The sterile probe there gently touches the corneal surface. I will look through the device, turn the wheel, align the wires and check the pressure. I have 16 mm of mercury on the right, start on 16 for the left, same again, just let it rest against the cornea. I have 14 on the left, a difference of 2. Time is 4:35 p.m. Right 16, left 14. And 1 drop of lidocaine fluorescein. Here, batch number and expiry date. I think I'm going to be extra safe and check your colour vision monocularly. Okay, you're not taking any medication, are you? Cover your left eye. Tell me what number you think you see on the plate. I'll do one more set and then compare against the left. Fantastic. Cover the other eye, please. And again, say the numbers you see. Okay, one more set, please. Excellent. I'm quite satisfied that the colour vision is normal in each eye. Ishihara. Right eye. Left eye. Cover your left eye again. To the right eye, look at the spot in the centre of the grid. Do you see any distortion of the white line? Appear normal. Cover the other eye. Eye on the spot in the centre of the grid. And is there any distortion to any of the lines? Any metamorphopsia? Thank you. Relatively normal looking Amsler there. Right, it's been almost 20 minutes. How does the right eye feel? Of course, we have to do some more neurological tests. Look into the distance at 1 point. Just going to have a look at your pupil reactions. ipsilateral right, ipsilateral left. And I'm just going to swing the light, eye to eye, blink normally. Okay, and you see one pen there, one pencil. Follow with the eyes only. Just the tip. I'm satisfied with your eye movements there. So pupils, direct, consensual right and left. Now a relative afferent, pupillary defect, eye movements full. Okay, before I let you go, I want to have a quick observation check of your optic nerve in the right eye. Look off into the distance. Come even closer. Apologies for the sandwich breath. Quite a normal looking non-glaucomatous optic nerve there. No swelling. Look over my left shoulder to the distance. Pink defined. Normal looking cup. A little bit of myelination, 2 o'clock. Nothing to worry about. Okay, we're going to finish off with some more ocular lubricants. Look up again. Take a few blinks. How do the eyes feel? Fantastic. We'll take the final notes. Hycosan extra. I'm going to recommend some of that for you to use 3 to 4 times per day, continuously. No need for any more therapeutic measures. Certainly no need for any ocular antibiotics. Just the ocular lubricants, right eye, left eye if you wish, 3 to 4 times a day. And I would like you to come back for a review of the right eye in 3 days, please. So if your eye now feels okay, I'm going to let you go.